Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And today I'd like to talk about the idea that whole person health is not equivalent to a long used term called holistic health, especially when holistic is spelled with an H instead of a WH. So what's the difference between whole person health and holistic health? Well, first of all, I'd like to just describe a couple of terms. First of all, holistic health is a term that goes back into the 1970s, in some cases maybe a little bit earlier than that, depending on who you're listening to. And during that time, there was a movement against relying on just traditional medical strategies to be healthy. And there were a lot of alternative practitioners in various disciplines, which I won't mention, that were promoting what they were doing as equal to or better than traditional medicine. And attempting to integrate these different strategies was called holistic health. Now, the terms, when it was spelled Holistic, holistic, meant pretty much a hodgepodge of things. It could be everything but the kitchen sink, and it could be holistic health. Now, the medical community pushed back against that as being quackery, because there's so many things that are being done under the banner of holistic health that have no basis in any kind of science. There's no research behind it. And in many cases, lots of people get hurt because it's just a scam, because all of these various things are under this big umbrella of holistic health. I don't use that term to describe what I attempt to recommend for patients. Instead, I recommend the term whole person health. Now, what's the difference? Well, whole person health is built on the foundation that the science of Western medicine is a good thing. It's a good starting place to look at physical health. It's not the only thing to look at, but it's a foundation that is critical to plug other things into that may be beneficial for health. Now, one of the things you're going to see in the internet and other places that attack alternative health practitioners who don't happen to have any research to back up what they do is that there's no science behind it, and that it is not evidence-based, whereas traditional medical practice supposedly is evidence-based. As being a doctor for a long time, I can tell you that the evidence for some of the things that doctors do is pretty good, and the evidence for some of it is not nearly as good, but we like to throw this term evidence-based instead of proven. See, there's a big difference between there's evidence for something and proof. And in the last 20 years, there's been this movement towards using the word there's evidence for this as opposed to there's not evidence for a certain problem or condition. And guess what? You can't accumulate evidence if you don't have millions of dollars to spend on studies. And much of these studies, many of these studies are funded by very, very large corporations that have a vested interest in the outcome. So the problem with evidence-based medicine nowadays is that a lot of it's polluted by corporate interests that have affected the outcome of the studies. And fully 50% of medical studies are thought to be flawed, some of them seriously flawed. So who can be believed? Well, I'm not trying to cast doubts on the medical industry. I'm just trying to say that it's not as black and white as one would think, and you have to use your head about thinking about what you're going to do before you use it, and you really want to look at the evidence. How good is the evidence? That's one of the reasons why when I prescribe medications for patients that are potentially controversial or potentially harmful, I ask them to look at a website that is abbreviated NNT, number needed to treat. And that's where people can go and actually look at the evidence. And most of the time they discover that the evidence for things like statins is actually pretty weak in terms of benefit. And so the idea that a doctor is saying that the overwhelming evidence is thus and such often isn't true. The overwhelming evidence isn't there. Some evidence is there. And so they use this phrase, evidence-based medicine, to push things that don't have that good of evidence behind them and certainly don't have proof. So opposed to that now, you have all of these other completely non-traditional approaches, some of them recently made up, that have no evidence beyond a bunch of anecdotes. What's an anecdote? It's a story. Well, if you get enough people telling the same story, you can get a lot of people believing that. And especially when the placebo rate is approximately 30% for any kind of an intervention, you can get 30% of a lot of people spreading a story around when there's nothing really true about it. That's why research is critical to differentiate the placebo effect from what's really something beyond placebo. And so looking at how good is the evidence is really critical. Now, sometimes there isn't much evidence that proves a point. An example of that is that we all know that love is a powerful force. We know people that love us, and we can sense love when we feel it. We can sense hate when we feel it. But there's not much evidence out there that it makes a big difference in medical outcomes. Why? Because it hasn't been studied clinically. It's been studied some, but there's just not much evidence. In the same way, there's not much evidence that spiritual health is critical for good physical outcomes, but there is some evidence, not a lot of evidence. Guess why? Because it hasn't been studied enough. And so on. There's many things that could be true and many things that are probably true for which there is little evidence simply because expensive multi-million-dollar research hasn't been funded by a drug company to see if it's true. So I'm not trying to say that just because there's no medical evidence that it's not true, but on the other hand, it's easy to slip things in that sort of defy both logic, reason, and the science that we do know, and make it sound like it's true because it is got a lot of anecdotes. And with that placebo effect that I mentioned, you can make a lot of things seem to be true and trick a lot of people into strategies that are not genuinely going to do them much good. So back to this concept, whole person health is a strategy that recognizes, of course, the body is critical for health. Physical health is how we experience ourselves most of the time. We obviously experience some emotional health. Not too many of us are aware of our spiritual health. Some of us are. But it's this integration of the three that, in my experience, has been the most powerful thing that we can do that will help us to become healthy. And why is that? Because of the condition called chronic stress. Now, there is a lot of evidence that chronic stress is the major factor in causing or aggravating all major diseases. There's research all over the place that stress is a cause of disease, and so it is reasonable to conclude that decreasing stress would be a good thing for the human outcome. And there is research to support that too. I'm not going to bore you with all the research, just to say that addressing stress through physical, emotional, and spiritual issues is the basis of whole person health. That's the critical thing that's different about whole person health as opposed to traditional medicine. Traditional medicine relies on focusing on medications to fix a problem and surgery to fix a problem, and some physical therapy maybe to fix a problem. But it doesn't rely on all of the various resources that we have at our disposal to use to decrease the stress that is making us sick. And there's so many different things we could talk about, just to say that we're not addressing most of those things. And the fact that they're not being addressed is the evidence that traditional medicine is insufficient as it's currently being practiced. because it doesn't address all of these factors that affect chronic stress, which affect disease progression and expression, and affect the ability to recover health. So the point that I'm trying to make is that there is a big difference between whole person health and traditional medicine. Whole person health recognizes that your psyche and your spiritual life is critical to decreasing part of the chronic stress response that's going on in you. And if you don't address them, you're leaving a lot on the table for controlling one of the most powerful forces that affects your health. But there's a radically difference between whole person health and holistic health. Holistic health is everything but the kitchen sink that anybody claims is helpful. Now, some of it's true, but there's not much evidence for it. And some of it's just a scam. And so part of it requires caution on the part of the consumer or the patient or whatever, listening to people that are trained and whatever. So I'm not trying to cast aspersions on everything that falls under the banner of holistic, but unfortunately, it's got some good things and some bad things all kind of lumped together, and there's no simple solution to figuring out which is which. So I just say buyer beware. But when it comes to whole person health, health of body, mind, and spirit, that's the foundation of health. And that's always been that way. It's only in the recent 20th century and beyond that we have approached health in a purely physical way. So I encourage you to pursue your health using a whole person health model. Be wary of some of these so-called holistic strategies, because some of them are not based in any kind of science, and they're not based in any kind of common sense either, but they are based in somebody trying to just create an income source. And sometimes they harm people. So I wish you well. God's blessings on you, and have a good day.